With COVID-19 and the guidelines and regulations for it, nurses are being forced to take on new roles and even more patients than they have in the past. If the nurse has to do more work and has more patients to take care of because there are not enough nurses in their area to take care of the patients, then the quality of work is lowered and then they will be giving subpar care to all of their patients. With the cases increasing and nurses being exposed to the virus, the need for quarantine is also increasing. If nurses are having to quarantine, then they will not have enough people as backups for the nurses when they are sick. Johnson J. found in December 18th of 2020 that the impact on nursing has been quite large because of the coronavirus. Because all things are connected, if the nurses are giving poor care to patients, then they will be taking longer for the patients to get better, and they will cause the patients to spend more money. This may seem good for the hospital, but will cause the patients to not return to that hospital because of financial issues if they have to stay longer than they should. That was found by J. Spetz in March 31st of 2020. They did a systematic review and found that hospitals must be staffing in areas that need the staff and laying off unnecessary workers that are costing the hospital money. COVID-19 has caused the nursing staff to need more training in certain areas than they had before. Hospitals need new employees to be training in certain areas that will be majorly affected with the coronavirus. There are more patients in need in the intensive care unit because of COVID-19. The ICU needs for their nurses to have extensive training in that area. They have found that certain cities are needing more nurses, and Catherine Brugger in October 30th, 2020, found that there were certain areas and cities that need more nurses in them because of how big their population is. This is due to the surges in areas that are not seen in smaller towns. The staff of registerednursing.org has found that California has the greatest deficit in registered nurses, and by 2030, it is projected that the United States as a whole will add almost 800,000 new registered nurses positions in order to handle the increased need for them. Because hospitals need more staffing, they will need to be able to afford those new employees. Financially, if the hospitals can afford to hire more nursing staff, they can increase their profitability and patient care overall. Financially, it costs more to staff the nurses, and they should reduce nursing staff in order to increase profitability. This was found in a study done in 2017. Because nurses are expensive to staff, they determined that the hospital will gain more money if they reduce their nursing staff. However, they have seen that nurses are one of the most important staff members in a hospital setting. They are responsible for the quality of care and the outcome of their patients. The authors have also found that hospitals will then have a better financial performance in competitive markets if the nursing staff is at a level that is effective for that hospital.